Hi there. Welcome back to our series, Overcoming Physician Burnout, the journey of the health architect. Now, last time we finished by talking about how physicians today really need to make a set of new oaths to their profession, central to which is a core commitment to their health and wellness. Now, complementary to that set of oaths, we need to have a practice model that is both concrete and practical in order to apply those principles into everyday practice. Now, as I was sitting thinking about the practice of medicine, actually in this very room in my house, I was struck by the similarities between architecture and medicine. Both disciplines are ancient practices that combine philosophy and science. Both we need in our daily lives, since we spend 90% of our time indoors and 100% of our time, of course, in our bodies. Both disciplines require many different people coming from different backgrounds and having different skill sets to come together and coordinate efforts and collaborate in order to make a high quality product. Just like an architect for a building creates a structure that has utility and beauty for its occupants by setting a foundation and various levels and even a roof deck in some cases. A health architect will set a foundation based on medical science and ethics. They'll create a first floor to diagnose disease and create a clinical plan. We'll then move to a second level where we convert that clinical plan into a care plan with different therapies and treatments that are appropriate for the patients who will receive them. And then finally, we'll get to a roof deck where we can see the horizon and the exciting possibilities for the future, but also be mindful that we're exposed to the elements that really represent our mortality. The oaths and this practice model are what define health architects and what we do. And if you're anything like me, it's likely that you're going to find that evolving into a health architect is a transformation from a transactional way of being into an experiential one. We don't just do things differently. We are different. And that is how we can bring meaning and purpose back into our professions, but also our lives. This is how we combat moral injury and burnout. Now, in the subsequent segments in this series, you'll see how we're going to get more granular. We're going to start with the foundation and see how medical science and the scientific attitude and medical evidence can help us shape what is medical fact and what is not. And also bring into the mix ethics, because that is core to our purpose as physicians. We'll then move to a diagnostic level, where in diagnosing disease and problems, we'll explore different workrooms, such as a technology workroom, how to apply technologies in the right way, exploring how to work with administrators to make sure that financial sustainability is achieved with them and as opposed to away from them. And we'll also look at referral patterns within what I call the horizontal network of healthcare, as well as the vertical network of healthcare. We'll take the clinical plan and we'll move to a second level of therapeutics, where we will be with patients and families as part of shared decision-making exercises to explore prognosis and quality of life and death and informed consent. And then finally, we'll get to a roof deck, where we will shift our focus a bit from health, which is the removal of illness and disease, to wellness, which is the aspirational pursuit of our full potential, not just medical, but also social, occupational, environmental, spiritual, or all of the above. In this series, you will see how we can practically apply these in the workplace and bring that sense of agency and connection back into our possession in order to combat moral injury and burnout in the most effective way. So we'll see you in the next section.